Good afternoon. Welcome to Dyslexia 101. I kind of titled this this presentation, "Yeah, Doc, I've heard about that, but what is it?" I hear that question frequently in my office. My name is Janelle Burchfield. I'm a clinical psychologist at the Children's Resource Group here in Indianapolis, Indiana. And I just wanted to show you my face in the beginning for a minute. So I think it's good to have a face with a name and who you're listening to, but from here on out, we're just going to see the slides. All right, so let's get started. Okay, first of all, what is dyslexia? Dyslexia has an easy and very literal meaning. It means difficulty with words. The word dyslexia has Greek and Latin roots. Dys is Latin for difficulty, and lexis is Greek for words. So there you have it. Some things that you might see in a child or an adult with dyslexia can be trouble recognizing words, sounding them out, and spelling and writing. At times, a dyslexic may have trouble discriminating sounds, which is referred to as phonological processing. Students with dyslexia often have difficulty sequencing letters within a word. They may have all the right letters, but in the wrong order, which we know can really change up what they're trying to say or write, like was for saw. All the right letters in the wrong order. So there are a few terms that the school world and the clinical world use to describe dyslexia. Schools often use the term specific learning disability in reading and written expression, whereas clinicians will often use the words dyslexia or specific learning disability, or both. We're all really talking about the same thing here. I have seen many students whose parents say they have been evaluated through school and they have an IEP for a specific learning disability in reading or written expression. And then they ask me, is my child dyslexic? I can usually say yes, that they are. In the past, schools have not used this term or have even said that they don't believe that dyslexia exists. Well, dyslexia does, and we have the research to prove that. Lately, there have been a few federal laws passed that urge schools to use the term dyslexia. Dyslexia is considered a neurological disorder. There are distinct brain differences between dyslexics and non-dyslexics. And dyslexia is a lifelong condition. This is not typically something kids will grow out of. Okay. So a little bit about what dyslexia is. Here's what it's not. It's not stupidity. It's not a child just being lazy and not trying hard enough. It's not retardation. It's not brain damage. It's not willful. It's not distractibility. And it is not reading backwards. Dyslexia is not a problem with the eye. Some facts about dyslexia. It is the most common type of learning disorder. Researchers estimate that it affects 15 to 20% of the population. So that's about 1 in every 5 students may have a dyslexia program. More frequently, it's identified in males, and females are under-identified. However, the rates of dyslexia are actually pretty equal between males and females. However, males are more often identified. This is thought to be due to possible more behavioral issues calling attention to the male students. Dyslexia is also genetic. It tends to run in families. If you have a parent that's dyslexic, their children have a 25 to 75% chance of being dyslexic as well. The difficulties for dyslexic students tend to lie in the left hemisphere of the brain. A couple of interesting points about the dyslexic brain. Like I said earlier, it's neurological in origin. When a dyslexic is reading, it actually takes longer and more steps to process. A student with dyslexia reads using part of his right brain, okay? Whereas someone without uses mostly their left hemisphere. This helps us understand how someone with dyslexia processes differently. It's just the way that their brain is naturally wired. But I thought this fact was interesting and exciting. When a dyslexic person improves reading skills, his brain map actually starts to look more like someone without dyslexia. We can see this change with the right kind of tutoring and help and support. I find that a lot of my students my students with dyslexia are very hard workers. They just are. In fact, they use more of their brain when reading. So some say their brain actually is working 5 times harder than others without dyslexia when it comes to reading. School is hard enough for all of our kiddos, so we really have to figure out ways to help these kiddos with accommodations and support. So now that we know a little bit about what it is, what do we watch for? Okay, so this is what we look for in preschoolers. When I'm talking to a family that has concern about a very young child and possible dyslexia or reading issues, this is what I ask about. Did they have difficulty learning nursery rhymes? Is it hard for them to come up with rhyming words like cat, hat, mat? Can they recognize and discriminate letters, numbers, or their own name? It's not uncommon for kiddos who have dyslexia to have difficulty recognizing their name at a young age. Have they showed signs of a language delay or disorder? Were they a kiddo who was eligible for first steps for speech or language? Are their words muddled, like aminal or animal, or paschetti for spaghetti? Some of this is typical, but some of it is a risk factor. Do they not like being read to? They won't sit still or they won't look at the books. If they like to be read to, do they not show any interest in the letters or the words on the page? If you say, show me a T, will they refuse? Do they have a history of ear infections or tubes? This can certainly be a risk factor. On to the school-aged kiddos. This is what we want to watch for in them. The first thing I ask about is there any immature speech? Like, will they say something like wed for red? Are they bright and verbal, but unexpectedly weak in reading or written expression? Do they have, again, all the right letters, but in the wrong sequence, like saw, S-A-W for was, W-A-S? Do they reverse letters or numbers? B for D, P for Q, 3 for 5, or some common ones. Is their writing illegible? Are they confused about directionality? Up, down, forward, backward, left versus right? Are they performing below grade level in reading, writing, or spelling? This includes looking at classroom tests and standardized tests. Have they failed the iRead? Not all kids who fail the iRead test here in Indiana have dyslexia. However, I strongly believe if a student fails, steps should be taken to figure out what's getting in the way. It could be dyslexia. Do they add or leave out small words when reading? Do they have trouble retelling a story, whether it's something that they have read or something that happened to them? Do their grades not match their intelligence? Can they not remember facts like multiplication tables, the days of the week, or names of people in their class? Have they been recommended for RTI, which stands for Response to Intervention? Do they complain about reading, saying, I just don't like it, or I'm not very good at it, or it's boring? Do they resist reading aloud in front of other people, either at home or in the classroom? Do they show some frustration that comes out as anger when it comes to school issues or homework? Okay, so some things to keep in mind with middle schoolers. I would say most kiddos are identified before middle school starts, but that's not always the case. But keep an eye out for poor spelling in their daily work, a student who refuses or won't ask for help. They really try very hard to hide their difficulties. They give you very little detail in their writing. You really get the bare minimum. If you ask them to maybe tell you a story, they would give you much more detail than actually physically writing it out themselves. Do they avoid reading and written work? Are they disorganized? So some high school signs and risk factors. Do they, again, avoid reading or writing? Do they struggle with learning or acquiring foreign language? Lots of high schools have that as a requirement. Do they demonstrate poor spelling skills or writing skills? Are their standardized test scores lower in reading, vocabulary, and language? Do they dislike school? Do they not do their homework? Do they say things like, I can't read, or I'm dumb, or I'm not as smart as the other kids? Sometimes we often see students in high school who may have dyslexia demonstrate symptoms of depression, anxiety, or maybe even aggression. Okay, so after looking at all of this stuff, if you're concerned your child or student may have dyslexia, the only way you can get an answer is to complete a comprehensive psychological evaluation. Okay, now this can be done through the school, or it can be done privately with a psychologist well-versed in working with students with learning issues. Some people take a wait-and-see approach. We get this a lot of times in 1st through 3rd grade. Well, this kiddo's in reading intervention. Let's just watch and see. We're not going to do an evaluation yet. They're improving. Okay. Most parents wait over a year to seek an evaluation. I'm a firm believer in early intervention, so I would strongly urge anyone who's concerned about this question to talk with someone and get an evaluation. Chances are when someone's concerned, there is something getting in the way for their student or their child. So don't do the wait and see. The earlier the better when it comes to evaluating for this. We can evaluate as young as kindergarten. Sometimes we might not be able to give you an exact, this is what it is, but we can give you a watch for this, and let's continuously watch and monitor. Okay, since I am a clinical psychologist in a private setting, I'm going to talk about the advantages of a private evaluation. First, some parents say they've asked for an evaluation through school, but the school won't test their child. Okay. They may say something like, we don't test for dyslexia. The wait for a school evaluation is 50 to 60 school days. You may seek a private evaluation if the school has tested your child, but you don't disagree, or your child is still struggling. You may seek to do this privately if your child is embarrassed by the problems that they're demonstrating at school. You may want to look at this option if you want to have control over who gives the test and when and where it is given. Typically, in a private evaluation, it'll be a one appointment session to do the testing side of things. Typically, what I see in a school evaluation, the assessments are given over a number of dates, and the kiddo is missing out on instruction time. Another reason why you might want to consider this is if you want to have some confidentiality in the situation. The only downside of a private evaluation is that you have to pay for it. But I'm a firm believer in sometimes you get what you pay for. Okay, some comorbid conditions to think about when it comes to kiddos who may have a dyslexia profile. With a comprehensive evaluation, these other conditions can be ruled in or out. First one is ADHD. Most of the students that I evaluate who have dyslexia also have comorbid ADHD. Not all my patients with ADHD have dyslexia. This is a very important piece of information to know because I rarely see kids make significant progress with good intervention if the ADHD is not diagnosed and treated before taking part in any kind of intervention. These kiddos are also big-time risk for anxiety and depression. If school's not going very well, these kids know it, and school is like their job, and so they feel it strongly, and a lot of times this will develop because of an unaddressed or treated dyslexia profile. Speech and language disorders, auditory processing disorder. A lot of people ask about what this is. A lot of people have heard about it but don't really know what it means. This is a term that applies to disorders that affect the way the brain processes auditory information. It leads to difficulties recognizing and interpreting sounds, especially in speech. This is a rare condition, and it's usually diagnosed by an audiologist. Sometimes after an evaluation in our office, we have concerns that a student might have an auditory processing disorder, and we make a referral to an audiologist. So after you find out that your child has a dyslexia profile, now what? What do you do? These are the usual steps that we recommend for our families to take part in and consider. The first step is really educating yourself about what dyslexia is. There are lots of ways this can happen. It can be through reading, it can be through websites, it can be through an ongoing relationship with a psychologist who's well-versed in working with kiddos who have a dyslexia profile. Next step is really getting a school plan in place. Whether it's a 504 plan or an IEP, this is a must. Okay? Some of the accommodations that might occur within one of those plans would be something like having extra time to take tests or complete assignments, quieter rooms for testing, whether it's classroom tests or standardized, shortened spelling lists, tests read out loud to them, access to audiobooks where they can listen and follow along will help with comprehension. We certainly at CRG always recommend outside tutoring. We typically recommend multisensory tutoring approaches like Linda Mood Bell or Orton Gillingham. Students need outside tutoring when they have a dyslexia profile. Oftentimes, school intervention is not enough. It's really important to introduce technology supports for these students early. Having them have access to things like audiobooks or keyboarding programs or talk-to-text programs can really help them with spelling, be able to have more detail in their writing, to be able to produce better writing samples. Another important thing to really consider is ongoing therapy. Especially if your child is diagnosed young, you will likely need someone walking you through this process who knows what to look for and what to expect and what to watch for. It's really important for parents to emphasize their students' strengths. Oftentimes, school's not going that wonderfully for them, so we need to pay attention to their strengths. Oftentimes, students with dyslexia are very bright. They often do well in math and science. They often have strengths when it comes to athletics. And they can also be very creative and have good kind of outside-of-the-box ideas. So we really need to pay attention to that. And finally, reading can improve. I see it happen on a regular basis with the right intervention and catching this diagnosis early. So that really concludes what I have prepared for today. Thanks for joining me during your lunchtime and for your time and attention. If you have any questions, you can type them in and send them on in. I can take a few questions before I see some patients this afternoon. And then my last slide has some books and websites that I found to be really helpful over the years. Thank you very much. Okay, it looks like we don't really have any questions. So again, thank you for your time and attention, and have a great afternoon.